Hello everyone, welcome to my YouTube channel Heart Tales. Today we are going to dive into one of the most critical decisions a medical student faces, choosing the right branch in medicine. Well, it's a choice that just not shapes your career but also your entire life. The branch you choose, and dare I say, the person you marry, are constants for lifetime. So let us make a wise and a well thought choice, shall we? I want you to consider these four important aspects while approaching this decision of choosing the right branch. First is knowing the branch well. Second is knowing yourself well. Third is knowing your financial goals and your current financial status. And fourth is the geography of your practice. Let us dissect the first aspect, knowing your branch well. By this, I mean that every branch has its own particular genre to it. It has its own vibe. It has its own way of operating and catering to its patients. I often see students being confused between the two extremes of this medical field spectrum. Like people are confused between radiology and medicine and surgery, dermatology and orthopedics. I mean, this confusion can only arise if you have not thought well about this branch and about your own inclination and orientation. Jokingly, I would say that this is like asking if whether a guy, me, should marry a girl or a guy. And that confusion will happen only if I'm not sure about my own orientation, right? So, if you're clear about what is your inclination towards life, and if you're clear about what that person, that branch is, it is easy to make a choice. So, why the confusion? If we invested only 1/3 of the time and energy that we had put into preparing for these exams into understanding the branch, the field that we aspire to get into, the decision process would be much more smoother. Let me give you some practical tips. Understand the branch. Every branch, as I said, has a unique vibe, a style, and a mannerism to it. Don't just follow the residents of the particular branch. The residents are burnt out, they are tired, and they don't reflect the exact final mechanism or the exact picture or the complete picture of the working of the branch. So shadow the consultants, shadow the professors sitting in the OPDs, operating in the ORs, because that is what eventually you'll be doing and not the residency part. It is just a tip of the iceberg. So get involved into the final phase of the patient treatment. Like the residents prepare the patient, they segregate the patient, they cater and do the pre and post op management and workup of the patient. But the final phase of or the crux of the treatment is done by the senior most of the department or of the branch. So try to observe that aspect and try to relate and see yourself into that role, because that is the eventual essence of the specialty or of that particular field of medicine. So observe the consultants, not the residents. A residency is tough across the board. So don't judge the branch by the residents' tiresome or burnt out life. Observe the consultant's schedule, his skills, his personality, his way of dealing with patients, his way of dealing and handling his branch as a skill set of his. And ask yourself, do I see myself being excited in doing what he is doing? This has been my observation since over last 13 to 14 years of being in the medical field. The branch you choose eventually has a certain deep rooted impact in your personality. It defines you in a certain way. In my observation, I see pediatricians being more cheerful. Well, they are around a subset of patients who, if they are not very sick and ill, are just happy and just going around everywhere in the wards. So these pediatricians tend to be a little more joyous. They They laugh, they know to smile. Orthopedicians, on the other hand, tend to be fit, rigid, and adventurous because they have to deal with the most rigid structure of the body. Dermatologists are kind of savvy and health conscious about their appearance. They look good, they want people to look good, and yeah, so the branch has an impact on you. Surgeons, on the other hand, are I feel a little more flamboyant, risk taking, and n number of possibilities that can happen with a surgeon's personality. But over and all, I see them to be a little more adventurous. Well, they have n number of possibilities that they can get shaped into because of the broad spectrum of general surgery and henceforth into super speciality. That's not mandatory, but in general, that could be my observation. Radiologists, radiotherapists are, they have more to life than just hovering around their patients and their clinical practice. So usually these guys are the ones who get into being entrepreneurs. They are tech savvy and do multiple extracurricular cultural activities, and that is why these people have chosen that branch, and they totally deserve to be there. So all these examples were given to just remind you that the branch you choose infuses you with certain core changes which becomes a part of you. That is also an important factor to choose, because once you know what is your organic inherent nature, it is easier to align yourself with the overall genre of the branch. And similarly, if someone has been into playing outdoor sports, or he has been an extrovert or an ambivert, he will be a little more comfortable into getting the skin of doing something manually like a surgeon does. Well, it is not mandatory, but in general, I'm just saying that if you have these certain qualities inherent, getting into such fields would be a little more easier, a little more convenient. Yes, you can always take up challenges to grow beyond what you are, but that is for us a smaller subset of people with different ambitions and situations of life. But in general, the more better you analyze your orientation, your interests, your tendencies, the easier it is to choose the branch once you have analyzed these branches. To give you a little more understandable analogy, I see different fields of medicine as different types of sports. So there is no comparison between different sports. It is just knowing what that particular sport is. We don't say that football is greater or bigger or better than cricket. There is no comparison between table tennis and cricket. It is just what the sport is. It is just what is the quality or the particular way the sport is played into, and I just have to see if I fit into football or table tennis. In this context, I get a very frequent question that should I be choosing general surgery or general orthopedics? So here is what I would like to say, just to explain you what I had mentioned earlier. See, surgery is kind of the fine art of painting, and orthopedics would be something like sculpture. So there is no comparison between what is good and what is not, what is more artistic and what is not. It is just the way it is. Sculpting is the hammer and the chisel, a little more rigid, and painting would be a little more finer, a little more colorful, a little more grace, That also is in sculpting, but to inculcate that grace, you have to have a certain set of skills which are very different from what you need to be a good painter. So, painting is surgery, sculpting is orthopedics. You have to decide what is your interest or what interests you more, what skill set interests you more. This is primarily most important than the scope of sculpting, the revenue generation from sculpting, the possibilities of general surgery, the scope of general surgery, and whatnot. This I feel is of prime importance in the budding stage of being a medical aspirant. I've seen people who are passionate about medicine being so happy when they find or localize a certain CNS lesion just by clinical diagnosis. That is how that brain works, analytical mind. So, if you are that, your branch is mostly something which is non surgical. Extending the sports analogy, I see general medicine and pediatrics as something like playing chess, so which is not much of mobility, not much of manual labor, but a full set of hyperactive cortex of the brain. And then you see the results, then you make out your diagnosis and treat your patients. So that is kind of playing a chess game. Likewise, going ahead with the same analogy, I feel cardiology or any medicinal interventional branch, any super specialization in medicine which involves some sort of intervention, is like playing a game of Carrom or like playing Snooker, wherein you have a limited field to play, but you require that particular manual skill set, and you need to be dexterous enough to play the game along with the analytical mind that also comes into play. And ENT and ophthalm is like playing table tennis, wherein you have a limited mobility, a limited physical labor, but it has a certain amount of distinct physical exertion to a particular anatomy. So that is why I say it is kind of table tennis. Obstetric and gynecology is like badminton. It's fast. It's again, it has that frenziness to it. It is physical labor, but the field is limited. The exertional limits are into a certain restricted area of the court. So that is why it is kind of playing badminton. And surgery, I feel, is like playing football. It is exhausting, it is explosive, it is adventurous, it has no restrictions in terms of what you do on the field. You need to be agile, you need to be fit, you need to be physically fit, you need to be mentally strong, and that is why one has physical injuries also playing that game. You get exhausted, you get burnt out. So surgery, I say, is like playing a game of football wherein the space is huge. It's a huge field that you have to maneuver yourself into. And radiology is like playing football on a PlayStation. It has that geekiness to it, that tech thing to it. And yep, so I'm just trying to tell you that these are different sports, these are different fields. You have to see to them in that way, in their particular way of catering to that population with a particular skill set, and you just have to see what you want to inculcate or what you have inherently inside you, and just align these match the pay is. I'm sure you'll be sorted to some extent.